cancer diagnosis is something that like lives with you forever. You're always just a survivor. It's never like you're cured.
It was time for an MRI, and that's when they found another spot.
A mother and daughter both diagnosed. Coming up, how early detection and knowing their family tree helped save their lives. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Libby Sinovic knew her family history. She had lost her Aunt Debbie to breast cancer, and her mom, Kathy, had already survived breast cancer once. Then in 2019, Kathy's cancer returned, and soon Libby would face her own diagnosis. Here's Janine Keesley.
We just thought this is a fluke. It just happened.
When Kathy Ritz's sister Debbie was diagnosed with breast cancer, Kathy, her mother, and her maternal grandmother had all already survived the disease. But when Debbie's cancer metastasized, Kathy was on a mission to find the best doctor to treat her sister. Everyone pointed her to Dr. Fabian at the KU Cancer Center.
She's this incredible researcher, and she was always on top of the latest studies, the latest, just everything. And we just knew we just had to be with her.
Dr. Fabian took one look at the family history and ran genetic testing and found a mutation of the ATM gene, which could increase a person's chances of developing breast cancer. Kathy started doing preventative screenings every 6 months. When her daughter, Libby Sinovic, turned 30, she too started with the screenings, even though Libby had not done the genetic testing.
I knew I needed to do the genetic testing, but I was waiting for the life insurance stuff. I even remember thinking, well, if I have the gene, it's not like I'm going to do anything radical about it. I'm not going to do a preventative double mastectomy or anything like that. Like, it'll just be a knowledge is power type of thing.
In June of 2019, Libby got married. She was 32 and ready to start a family. It was the happiest time of her life. But the following month, Kathy was diagnosed for the second time with breast cancer. Thanks to the prevention screening, Kathy's cancer was caught early. In August, Libby went in for her routine screening.
So this August appointment happened to be an appointment where I was doing imaging. They did a mammogram and ultrasound because I had extra dense breast tissue, so the ultrasound can be more revealing. And at that appointment, they told me, they had the radiologist come in and say, you know, we did find a lump.
Doctors did a biopsy of the lump to be cautious, but Libby was only 32 years old, and she wasn't too worried about it being cancer. Then she got the call.
It was awful. I was at work. I'll never forget it. It's life-changing. I mean, I called my husband. Like, it's hard to even say that out loud, you know, because it's just news you were just no one's ever prepared for.
Libby and her mother both underwent double mastectomies, and both are doing great. Libby just gave birth to a healthy baby girl, and Kathy is loving being a grandmother to little Josephine. Both women credit their success to the doctors at the KU Cancer Center.
Our oncologist, Libby and I both see her, is incredible. She's so compassionate. She's so, I'm at a loss for words to describe her. And just the care that we have had there has just been amazing. It really has.
They're incredible. The care we received, it makes me emotional because I just always felt like we were such a priority. I always felt like we were heard.
So glad to have both Libby and her mom, Kathy, joining us this morning, along with their medical oncologist, Dr. Lauren Nye. Dr. Nye runs the high-risk breast clinic here at the health system and also specializes in not just treating breast cancer, but managing breast cancer, including prevention, screening, treatment, and survivorship. Kathy, good morning. I want to start with you. We heard in your story that your mother and your grandmother both faced breast cancer. Did you think there was a greater chance you would get it too? Were you always wondering that?
Good morning. Honestly, no. My grandmother received the news of her breast cancer in the early 80s. I was in my 20s. So we just thought we took care of it. She was fine. And then in 2000, I was diagnosed, and my mother was diagnosed after me. And then in 2012, when my sister Debbie was diagnosed, that's when we're like, okay, something is very amiss here. So then that's when we chose KU Med and went through all the genetic testing.
Yeah, so you came to the Cancer Center, and then you're thinking, of course, your thoughts go to Libby. And Libby, we know that knowledge is power. You were empowered with the knowledge of your family history, but mentally, did you feel a sense of dread, or just that maybe you were on top of it?
I always felt like we were on top of it because we were. Starting at the age of 30, I was being seen every 6 months. And at that time, I don't feel like I knew anyone who had been diagnosed so young. When my mom was first diagnosed, she was 40. But at 30, 32, that still didn't seem like a possibility or a potential.
Right. And you said your mom being 40. I mean, 40 sounds young. So it's always surprising when we hear people in their 30s and certainly young 30s. Dr. Nye, let's bring you in. And I want to talk more about the ATM gene and the mutation that increases the risk of breast cancer. Talk to us a little bit about the increased risk and what we should know.
Good morning. So a lot of people are more familiar with the BRCA or BRCA genes, but there's a handful of genes that can contribute to an individual's risk of breast cancer, and ATM is one of those genes. And that can increase a woman's risk of breast cancer up to 40% or even higher, depending on the variation or variant that we see in an ATM gene. And we're learning more and more about these genetic mutations. And we know that women and men can be at risk for cancers if they have an ATM genetic mutation, such as prostate cancer, pancreatic cancer, and maybe even ovarian cancer. But breast cancer is the greatest risk associated with the ATM gene mutation.
So Kathy and Libby, you both had double mastectomies. What insight could you share with somebody facing the same surgery or just the decision to get that mastectomy? Libby, we'll start with you.
Insight, I would say, you can do it. It's the most daunting thing to be presented with, but, and I remember even thinking when I was faced with that decision, like looking for any reason to not do the full double mastectomy. Like, can't we just do a lumpectomy? Can I just have a single mastectomy, not a bilateral? But the peace of mind that I have now, having done the surgery and feeling that much more confident that my risk of recurrence is lower because of it, I would say it was worth it. It's hard, but you can do it, and it's worth it.
Worth it for sure. Kathy, what can you share about your experience?
I agree with what Libby said. It physically and mentally, it's hard. It was probably one of the hardest things I've ever done in my life, but I knew that I had to do it. And my sister Kim, who also has the gene, she has not been diagnosed with a breast cancer, but she did choose to have a double mastectomy. And because I remember Dr. Fabian telling her, it's not if you get it, it's when you get it.
And we know support is so important during cancer treatment. Libby, let's talk about this. We can see some of your support system in these photos. Tell us who's in them and how important this was to you and how you and your mom leaned on each other.
Yeah, our family and circle were just amazing. I know my husband, like, he doesn't physically go through what I was going through, but very much so was in it just as much as me. So his support was incredible. And then friends, I have 3 siblings, so my siblings were there for everything. My parents, of course. We had such a team rallying around us. And my mom's big surgery was a week before mine. So getting to see her do it with such strength gave me that confidence that I could do it. And having seen her go through chemo, 20 years prior when we were younger, that also gave me, the confidence and the strength that I could get through my journey as well. So, I would say our support team couldn't have done it without any of them.
Yeah, Kathy, it's certainly not what we think of when it's, we want our daughters to follow in our footsteps. But to know that you could have kind of led the way for Libby, what did that mean for you to be able to be there with her?
Well, who wants to be there? You know what I mean? Who wants to go through that with your daughter? But I was, again, I felt like we both learned a lot from each other during this journey. And our family could not have done it without them. Our group of friends, it was an amazing journey.
Yeah, you're finding the bright spot in it for sure. Dr. Nye, the ladies had mentioned, and with this gene, it's not a matter of if, but when you get diagnosed. Is that true?
Not for everybody. So some individuals, there's a lot we're learning about genetics. So there's some families that might have an ATM mutation where we don't see a lot of cancer, or we haven't even seen a breast cancer. But then you have families like their family where probably majority of the women who have this ATM gene mutation have had breast cancer. And we think that's really telling to the story. And so talking to a genetic expert or genetic counselor about somebody's family history and their genetics is really important in that decision making. And I will say that along the way, Libby really took all the information she had to make her decisions. In the beginning, she wasn't ready for genetic testing, and that was okay. We were able to still do the important screening that she needed, and she wasn't ready for a bilateral mastectomy in the beginning. Unfortunately, breast cancer pushed her decision to be sooner than she was ready for, but she was able to take information that she learned from everyone and make the right decision for her along the way. And I think that's really important for everybody to know and understand.
Yeah, and just how far everything has come since when her grandmother and her aunt were diagnosed. Just the new information that comes in and what you're able to do and present to her as options. Libby, I have to ask you about something. We were showing some photos earlier, and this cap. What's the cap that you're wearing during these chemo sessions?
Yeah, so there's something called cold capping. It doesn't work for everyone. It's not even like promoted for every type of cancer or whatever type of chemo you're going through. But for mine, it did work. It's a process where you literally are wearing these freezing cold caps on your head throughout the entire day of chemo, not just during your infusion. You start it before, you are doing it throughout your treatment. And then when you get home from treatment, you're doing it. It's like a 8-hour day. And again, you're switching these freezing cold caps on and off your head in hopes to save your hair, which it did work for me. I lost some hair during chemo, but for the most part, I was able to save my hair. So when I was feeling good and going to work and doing normal things, I felt normal and didn't feel sick. And it was a blessing for me, especially at my age and everything. So.
Yeah, you look better, you feel better all around. Those little things matter, like our hair. We take that for granted, don't we?
Yeah.
So Dr. Nye, Libby started screening young at the age of 30 because of her family history, caught the cancer at stage 1A. So we're talking about early detection, saving lives. How early was Libby's cancer caught? What did that mean?
Her cancer was caught at the earliest stage that we can catch an invasive breast cancer. And that's why we have our high-risk clinic and why we make these recommendations for additional breast screening. We're lucky to have such an amazing breast imaging program that can offer breast MRIs. And now we also offer contrast-enhanced mammograms for women that can't do MRIs. So that additional screening really does allow for the early detection of breast cancer in women who are high risk. So it's really important to know your risk so you can get the appropriate screening that you need.
So you mentioned that Libby and Kathy both got breast MRIs. I want to pull up Libby's first. Dr. Nye, what are we seeing in these images?
Oh, thank goodness you put the one with the arrow. Our breast radiologist did that for us, but you can see in the breast that would be on the left of your screen, which is her right breast, there is a mass that the arrow is pointing to, and that little mass is not something that we were able to palpate in clinic or that Libby would have been able to feel on her own. It was because of the screening that we were able to identify that mass at such a small size.
Let's go to Kathy's MRI and see what we're looking at there. Kind of
similar, yes. Also an arrow there because that one looks even smaller on the screen. But again, something so small that I don't anticipate women would be able to feel, and they may not have any changes in their breast with a mass that small. And that's the importance of screening. We want women to be aware of their breast. I say self-breast awareness, know what they look and feel like, maybe once a month. But the screening is so important for early detection because those early stage breast cancers, we don't expect women to be able to feel.
So as we've mentioned, Libby's cancer was caught early. Curious, would a lumpectomy, would that have made sense in her case?
That's really a personal choice. Libby could have considered a lumpectomy, and we talked a lot about that. But Libby was really young, so her chance of getting another breast cancer in her lifetime is about 0.5% per year after you're diagnosed with breast cancer. So if you're diagnosed at 30 and you're going to live till 80, that's a 25% chance of being diagnosed with a brand new breast cancer again in your lifetime. And Libby was really thinking about her future and building a family, and that wasn't something that she really wanted to take on again, and she had the opportunity to consider that bilateral mastectomy, which, as you heard, was not an easy decision.
It's not, yeah, but she's in life for the long haul, so that makes sense. The younger you are, the more years you have to be thinking about. So on that note, Libby, we're actually having you back on the show a week from today to speak specifically about how fertility played a part in your treatment, and I'm sure this is beautiful baby Josephine, already getting spoiled, I'm sure, certainly by Grandma Kathy. We're going to look really forward to that conversation. Just an interesting part of a cancer diagnosis when we're talking about a young patient. So Kathy, you see Josephine here in these images. Just what are your hopes for your granddaughter, knowing your family history and what has gone before you and what lies ahead?
Well, my hope for that sweet little baby is a long and meaningful life, and that she's takes the advice of her smart mama here and just knows who she is, knows her body, realizes that knowledge is power. That's kind of our mantra. And my hope is that she's just like this girl right here.
So Dr. Nye, so for Josephine, when does her screenings need to start? What does her future look like as far as catching anything early or not having it at all? What can she do?
I'm sure you'll learn more in the upcoming session about oncofertility, but there are some exciting ways to go through fertility and screen out genetic mutations. Not everybody's comfortable with that plan, or not everybody has that opportunity, depending on how many eggs they were able to form. But typically, just like Libby was, 32 when you were diagnosed. And so that means that between 22 and 25, I would want to see Josephine in clinic. And hopefully I'll still be doing this and see Josephine in clinic. And we'll talk about her individualized risk of breast cancer based on that family history, because genetic is just one component of that. And we'll talk about the screening recommendations that we'll have 20 years from now.
Yeah, exciting things that lie ahead. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a check-in with Dr. Dana Hawkinson this morning. How are you?
Hi, doing good.
Hi.
Doing good.
COVID count.
Yeah, I think we have 14 this week. We had a couple in the ICU, but we did not have any on the ventilator, so that is good. So that the number of active cases dropped this week compared to the last couple weeks, and that's good news as well. Also, really not seeing any RSV or influenza in the hospital at this time either.
All right, let's talk mosquitoes. So we talk a lot about West Nile cases in Kansas from time to time, and now further south, the state of Arkansas has reported a case of locally acquired malaria, meaning that they did not get this on a trip overseas. So, Hawk, we don't want to cause any unnecessary concern. So 2 questions for you. How concerning is malaria for you as an infectious disease expert, and how concerned should just the average person like the rest of us be?
Yeah, I mean, as an infectious disease expert, I'm concerned because we really eliminated malaria from the United States in the 1950s. But now, in 2003, we had a couple of cases in the United States that were locally acquired, and now we've had several case reports and series of cases. There were some in Florida, some in Texas. There was one in Maryland recently, and then now this. So it is concerning. I think it's one more thing that certainly we need to look at when we see sick patients in the hospital, and physicians need to keep that in their differential diagnosis if patients come to you with acute illness. Overall, as the general public, again, I don't think there needs to be fear involved. Just remember, if you're going outside, especially in the evening times, it is very important to wear bug spray with DEET in it to really help prevent those mosquitoes from biting you. There should not be a large cause for alarm, but just be smart when you're going out and being outdoors and doing things in nature.
All right, thanks so much. Let's get to some questions from our viewers today. Perry wants to know, Dr. Nye, and you mentioned how things are advancing so quickly in the field of breast cancer treatment, but if you've gotten a genetic test before, does it ever make sense to get another one? You get one, and then down the road, maybe something is advanced and could find something that it missed before. Any reason to get tested more than once?
Absolutely. Our genetic counselors at the KU Cancer Center typically recommend checking back in with your genetic counselor every few years, especially if you were not found to have a genetic mutation or variant that explained your family history, because we're learning more about genetics. So 10 years ago, we weren't testing everybody for the ATM gene mutation in our genetic testing panels like we are today. So 10 years from now, there may be other genes that we're looking at that we didn't know about.
Okay, Yen has a question. Dr. Nye, many women find breast imaging examinations to be painful. Are there newer machines in the U.S. now making that experience a little bit more comfortable?
I think our breast imaging is always trying to improve the experience for women. Of course, we don't want women to be fearful of their mammograms. We also want to make sure we get the best images. I would recommend avoiding caffeine before your mammogram. That can make your breast more tender. You can take a Tylenol if it's okay with your primary care doctor to try and decrease some of the pain. But it's quick, it's easy, it's a little bit of pressure, but the most important thing is getting those best images we can.
Jen has a question for Kathy and Libby. How does your follow-up care look like? What does that look like?
I still see Dr. Nye frequently, just because the past couple years I have been on my fertility journey. And so with pregnancy and all of that, she's just keeping an extra close watch on me. I think I'll see her again in January, and then we're going to move to more of a see her every 6 months as opposed to every 3 or 4 months that I'm doing now. And because of the type of breast cancer I had, I'm on an anti-hormone regimen. So I am at the cancer center every month for a shot, and I take an oral medication every day.
Kathy?
I see Dr. Nye every 6 months, and next year is 5 years for me from this diagnosis. So, and I also take an oral anti-hormone. So it'll be interesting to see what year 5 brings.
That's really good news, though. Glad you both are doing well and staying up on your health. Question for Dr. Nye. This is going to be the last one. It's from Lisa. This was a hot topic I don't know, maybe a decade or more ago. We all remember when Angelina Jolie got her double mastectomy as prevention before she ever had cancer. Of course, her mother had died of cancer and she was at higher risk. So Dr. Nye, as a medical expert, how do you feel about this idea of removing breasts before cancer even appears? Is this a go-to option, or what else needs to be thought about?
I think, as we saw here, that's a really personalized option and opportunity. I think the Angelina Jolie effect, as we call it, did great things for genetic awareness and really moved things forward in terms of knowledge in the community about genetics. The bilateral mastectomy or risk-reducing mastectomy isn't the right choice for everybody, but it is something that women with a really high risk of breast cancer could consider. We do need more information on the morbidity or kind of the toxicity from a bilateral mastectomy, and if we're really saving lives with a bilateral mastectomy for some women. But that's why it's really an individualized decision. We need to look at the family history. We need to look at the genetic information. We need to consider the woman's age if she's diagnosed with a breast cancer to really formulate what's the best decision for her.
All right, Dr. Nye, I know you have a tight schedule this morning. Before we let you go, what's the big takeaway from our conversation?
Know your family history, know your risk of breast cancer, and talk to somebody about what the best screening for you is, because screening leads to early detection and beautiful lives.
Thank you so much for your insight today, Dr. Nye. Kathy, Libby, what do you want the takeaway from your story to be?
I would echo what Dr. Nye said, just being aware of your family history, being curious about your health, about your family history. It's not the most comfortable thing all the time, but again, the early detection is everything. I mean, it's the reason that we're both where we are today. So even though it can be scary and daunting, just you can do it and face it, and you'll be better for it.
Yeah. And you'll get to live a long, beautiful life because of it.
Yep. Love on those grandbabies, Kathy.
For sure.
Absolutely. Ladies, thank you so much for sharing your story. We really appreciate it, and we're so glad you're doing well. A special episode of the Morning Medical Update dedicated to breast cancer will air on KCTV5 and WIBW this coming Tuesday. Here's a preview. Coming up next week.
I just was taking a shower, washing, and then I felt a lump.
Breast cancer, from diagnosis to treatment and beyond.
So many people keep telling me how strong I am, and it's not that I'm trying to be strong. It's just I have 4 kids that need me.
Since the moment I was diagnosed, I wanted to get this thing out of me.
Specialized doctors working together, improving the odds of survival.
Someone you love will live because of this cancer center.
Cancer Choices, Hope, and Science airs this coming Tuesday at 9:30 right here in Kansas City. That's on KCTV5. And then also in the Topeka area, it's on at 9 o'clock in the morning on WIBW. Thanks again to all of our guests today, and thanks to our viewers for being with us as well. Have a great weekend. We'll see you back here Monday. Coming up Monday on the Morning Medical Update. Why make mammograms a chore when they can be a party? I'm Jessica Lovell. On the next Morning Medical Update, we meet a group of friends who turned their yearly breast exams into a girls' road trip. Plus, we learn when and why some women need more than just a mammogram. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.